Glenn Burley, Chief Exec of South Warwickshire FT, George Elliott and Wye Valley, and you're listening to the HSJ Health Check Podcast.
Hello and welcome to the HSJ Health Check Podcast. I'm Dave West, HSJ's Deputy Editor, and each week we will gather a cast from our team of expert journalists to explain and debate the most important news issues right now in NHS policy and leadership. HSJ Health Check brings you a uniquely up-to-the-minute, robust and informed analysis. We're available each Friday morning on the hsj.co.uk website and across all the main podcast channels. This week, I'm joined by one of our podcast regulars, HSJ Workforce correspondent Annabelle Collins, by our Bureau Chief for Finance, Lawrence Dunhill, and by Rebecca Thomas, who covers the West Midlands for us, among other things. In each episode, we'll tackle 2 or 3 big issues from the week's news, and it has been a very newsy week for the NHS. But I want to focus here today on 3 stories. Firstly, the developments in the unfolding Shrewsbury and Telford maternity scandal. Second, the latest developments in the NHS pensions crisis. And thirdly, the curious case of the latest departure of the latest in a string of Barking, Havering and Redbridge Trust finance directors. Firstly, we're going to start with Shrewsbury and Telford, where in a case of the Shrewsbury and Telford Hospital Trust, HSJ has covered over the last year or so emerging and severe concerns about standards and care failings in maternity services, and big story has broken this week, revealing more about the extent of that. There is an independent investigation still ongoing, and lots of questions outstanding. So there's only so far we can debate that issue in and out this week. But Rebecca, could you start off by telling us what have we learned new this week about what's happened in Shropshire?
Well, we knew the review was being undertaken. What we've learnt this week is the scale of harm that's been found so far. So 42 examples where failures have led to a child's death, which I think that's a staggering figure on its own, let alone if you compare it to what was uncovered in Morecambe Bay. I think that was 11 children. So what's new this week is really how big this scandal could potentially be, and of course there's still hundreds of cases yet to be reviewed. So for all we know, the figures could double in a year's time.
Okay, I think it's pretty important to underline that the investigation, the news this week is from an update on the investigation early in the year, isn't it? So we await the final findings. But it sounds like the impression is it could be some time before we find out those final the final scale of what's happened and the final analysis of what's gone wrong. Is that fair to say?
Yeah, definitely. I mean, and there'll be loads of questions to answer along the way. Particularly the role the regulators have, or questions for the regulators, NHS England, CQC, NHSI. It's too early to tell, but those are questions which will most likely be explored at some stage.
What sort of a state is the trust in now, Rebecca? It's kind of lots of the people still there, or is it a whole new kind of leadership team there now?
Yeah, the trust virtually has a new leadership team to the one that was in place last year. So the leaders now currently are not those who will have had oversight of any of these issues before. So certainly a big challenge for them, and the new chief executive that's due to come in February next year.
And was a lot of that turnover because of these problems emerging, or is it kind of difficult to say?
You can speculate. You could strongly speculate, yes, it could perhaps be connected, but we don't know. I couldn't say for certain.
They've had a lot of other things going on.
Well, yes, so they've had a lot of attention on their A&E performance, for example. But yeah, this could have likely played a big factor.
Yeah. It'll be interesting to see where it goes now. Often with these scandals, it kind of starts off with one organisation or trust, and then people start to scrutinise the wider oversight from regulators and the Care Quality Commission. And is it right in that the CQC actually rated their maternity services good a couple of times within the last 5 years or so?
Yeah, they did, and I think those that read our story, Bill Kirkup gave us an interesting perspective on how the CQC is able to pick up things like this if potentially a trust is not being transparent about an issue, but we don't know if this is the case. Then it's interesting to know interesting to think about what your take is on whether it should be that in that staging process, whether we should have a trust and then look at the system and then look at the regulators, or whether that should be at the same time. Question to ask.
Whether it's possible to review those things at the same time. Yeah, I mean, you would think that in these circumstances, the regulators are looking at what they've done. Whether they can't publicly. There's a sort of an established process where they can't establish norms where they can't sort of formally reflect on it all or openly reflect on it until the review has taken place, isn't there? Whether that's right is perhaps interesting, but the trust itself has sort of made point to stress, although has made a point of stressing we have been taking lots of actions over the last year or whatever to deal with the issues, though they haven't specified what exactly they've been doing and whether they can deal with it all until it's out in the open. We don't know.
What's the response of the trust been like, Rebecca?
Well, the statement they put out on the day the news story broke was, in all honesty, quite vague and kind of only said the minimum, which I suppose it is somewhat handicapped in what it can say. What it didn't do and what it could have done is what work has been done to address what has been raised by the report, because the trust, this interim report has been kicking around since January. So what action plans have actually been put in place to address all of these problems? We don't know.
All right, thanks. So clearly a serious case, which looks like it will have big consequences in it on a number of fronts, and of course we'll follow that as more becomes clear. Let's move on to our second issue for today, which is one we've returned to a number of times already on our Young podcast, which is the pensions crisis, which is playing absolute havoc operationally in the NHS at the moment, especially as we go into winter. And there have been two developments effectively this week, one of which from HSJ on Monday we published a leader by our editor Alistair McClellan, making the point particularly more about the long-term issue under the headline "What if the doctors don't come back?" Making the points about that doctors actually are realising as they stop doing additional work because of the pensions problem that they may enjoy a work-life balance. But first of all, the more pressing short-term issue broke early in the week when it emerged that NHS England and with interaction with government had been cooking up what they hope would be a sort of stopgap solution to this problem for the current year, which would obviously be a big deal if it could be successful. And so, Annabelle, could you without wanting to go through all the history again, talk instead about what's changed this week on that front?
So I think it's important to talk about the context behind this to start with. So that is Pauline Phillips' letter sent to all trusts. We discussed this on the podcast just a few weeks ago. And that letter was unequivocal in it's sort of, I think the wording was really strong, saying that trusts must do something about the pensions crisis and the fact that doctors are not working extra shifts. So this is a reaction to that. I've been told that this is something that has come from NHS England, and it was described to me as a sincere attempt and a genuine creative solution to the problem. But this is certainly something that's a short-term measure. As you said, this is only going to be in place until March 2020, and the hope is that it will help to ease some of the winter pressures, to keep some of the lists running that they're worried are going to be cancelled. although obviously the main pressures we're going to be seeing over the winter are in emergency departments. So as emergency clinicians, my understanding is they're not necessarily going to be working extra programmed activities in the way that some of their elective colleagues might be. So I'm not completely clear on how them cutting down would have affected emergency performance.
Do you think the early reactions from the medical profession, does it look like this solution is a solution, assuming it gets finalised, which we can talk about in a minute? It hasn't been formalised or finalised yet. The proposal is in very simple terms, I think that the doctors wouldn't lose out because of a fix around putting the money that they would have had to pay, taking out of their pension fund and recompensating that in future. Does it look like a sort of fix that will work, that will simplify things enough for the doctors that would be affected to go and do that extra work, as soon as over the next few weeks and months?
Well, I think the short answer to that is at the moment we just don't know, because there's been absolutely no detail on this proposal. We haven't had, there was a promised letter that apparently had been sent out. I've not seen a copy of it. I'm not sure if it has been sent out. As I understand it, we're still waiting for sign-off at quite high level. So
I think all the signs are that while the solution has been fairly well developed internally, there's as yet it's not had as we speak on Thursday lunchtime, it's as yet not had the kind of sign off from everyone involved that would be necessary to get out and tell the workforce, which is obviously the absolute crucial point, is to get it out to doctors.
And at the moment it's obviously a tricky time with the election going on, so perhaps that could be a factor in why it's not been signed off. But it's interesting because what we know so far, it has been described as a twist on scheme pays, which is the mechanism that people can use to use their pension pot to pay off their tax bill. And as I understand it, and apologies if this is incorrect, but that it will be reimbursed upon their retirement by their employer, which to me at first sounded quite expensive, but then I suppose we're not talking about a huge number of people. And this would be an expense that an NHS in the future is going to have to pay out, because some of these people might not be retiring for decades.
I think we're also talking about sort of desperation, aren't we?
Yeah, no, it's totally, and I think they're right to be desperate. I think as Alistair said in his leader last week, maybe the doctors won't come back, and I think that's completely right. I think it's not all about money. I think it actually perhaps, why is it strange that doctors only want to work their contracted programmed activities? I think perhaps some of them, but I think it comes down to the fact that there are workforce shortages, because if we had enough consultants, then they wouldn't need the ones already working in the NHS wouldn't need to take on extra shifts. So there's obviously another argument there about workforce planning and kind of just general shortages.
I'm curious what you think the catalyst has been for this to happen now in the middle of Purdah. I mean, winter's been coming for a long time. I mean, this pensions issue has been a long-running issue. So why now and not 2 months ago?
Again, I think coming back to that letter from Pauline Phillip, I think that was the straw that broke the camel's back in this situation. I think the BMA and other medical unions, the HCSA, have all been campaigning pretty tirelessly on this over the last few months, and it's got an awful lot of national pickup. I think once this started affecting patients and waiting lists and warnings about patient safety, it got people's interest. I mean, I did see arguments on social media that this wasn't going to be a very popular topic to win votes in an election. I mean, these are some of the most highly earning people in the country, and we're talking about an annual allowance of £40,000, which is more than a nurse earns in a year, to put it in context. So it is interesting that they've brought it up now. It's not necessarily going to be a vote winner, but I think it comes down to fears about electives being cancelled, and we've seen a story this week with a trust saying they're cancelling all their electives. So I think it's a very real fear.
And I mean, you quite, absolutely agree that the main impact could probably be on the elective waiting list. There is a sort of some knock on emergency care, and at this time of year, everybody just gets very nervous and very sensitive and very rightly concerned about pressures and safety in in emergency care. Don't think it sounds like, as you say, that letter from from Pauline Phillip, the emergency care, the performance czar, the other week sort of crystallised this kind of fury and focus on actually needing to do something. Have you heard anything from chief execs or sort of local leaders about in response yet to this to the developments this week? Or
again, I think there's frustration among the chief execs and other quite senior managers I've spoken to that this once again only applies to doctors, and of course other professions impacted too, particularly managers. Somebody I spoke to has said that they are very concerned about the equality argument when it comes to this, and how perhaps there are other members of the workforce this is affecting that aren't going to be helped by this stopgap measure that's being introduced for clinicians.
Yeah, I think that's key. In terms of senior NHS managers and other professionals feeling left out of this, although they're not sort of operationally the crucial ones right now, aren't they? But also have picked up a bit of, you've got to be concerned about this gap between the sort of plan leaking on, I think Tuesday evening, and then we're now Thursday lunchtime, and no confirmation and formalisation. The longer whoever's involved allows that to get on, the more space and airtime there is for people who would come out and kind of say, actually, we don't trust this, it doesn't make sense because there's no detail. The less likelihood of it actually being able to land in a successful way, because if it's going to be successful, it's going to presumably need a lot of the medical leadership to get behind it and persuade their fellow doctors that you should trust it and believe in it and work on the basis of it.
Yeah, and the BMA will have a huge role in this, in getting their members on board. I think it's interesting, as you say, that it hasn't been signed off yet. Usually when something like this is going on, I'm just thinking of the Agenda for Change contract. There's a whole committee that has to sign that off at a high level, and this is something that they're trying to turn around in a number of days. I mean, we don't know how long this has been in discussions for, but I mean, I wouldn't imagine more than a few weeks, surely, considering when the letter came out.
It's a really interesting issue to come up sort of during a general election campaign, isn't it? Because the NHS has sort of taken centre stage so far, that Labour have made it so. But this is in a way the number one pressing issue for the NHS at the moment. So in some ways you'd expect them to really hammer this point home, but they've been reluctant to do that because, as you were saying, they know a lot of the people who have lost out are quite high earners, and those are of course the people they want to tax more. And so it was interesting last week at the Labour's NHS kind of event that they wouldn't commit to scrapping the taper or anything. All they'd said is they would review it.
Really, that's interesting. So I think we know that Matt Hancock is in favour of scrapping the taper. So it'd be really interesting to know what the Labour take on that would be, because obviously this just isn't an issue for the NHS. The taper applies to the whole of the public sector. So if you do something for the NHS, do you have to do it for high-earning judges, firefighters, very senior members of the police force?
Yeah.
So the impression is Labour are not. Labour said they review it. They haven't hurried to actually put forward a solution, and we're interested to watch probably this weekend from the Conservative manifesto whether the suggestion, I think, Annabelle, is that the Conservatives, or Matt Hancock at least, do have a proposed solution in their head that they may like to put in their manifesto. Is that fair?
Yeah, I think so. I mean, I'm not sure whether it's going to be in their manifesto, but I think considering the pressing nature of this issue now, perhaps they just can't escape it.
Okay, thank you. Back to pensions again in not too long away, I'm sure. But let's move on to our final issue for today, which is a sort of interesting case in relation to the Barking, Havering and Redbridge University Hospitals Trust in East London, which is a kind of long saga of financial problems and sort of getting itself into hot water over trying to solve those. But this week, the latest finance director there has decided to announce that he's going to leave, and it's an interesting case for a number of reasons. Can you explain why, Lawrence?
Yeah, so the finance director, Nick Swift, announced his resignation earlier this week. There's an email that went out to staff. He's been there about 14 months. And the message was interesting because staff were told that he wanted to take responsibility for the lack of progress that they'd made on recovering their finances. For those that don't know the background, the trust had a kind of a major financial collapse in 2017 before Nick Swift's arrival. The board realised there was a huge hole in the budget and had to ask the Department of Health for an emergency loan. Subsequently, kind of multiple external reviews revealed a whole raft of management and governance failings. So Nick Swift was appointed in September 2018, and it kind of looked a really interesting and in some ways impressive appointment at the time, because he'd had 20 years largely in the private sector, including as the chief financial officer of British Airways. And so it felt like it really could be a turning point for Barking, which had become a kind of byword for financial failure in the NHS. But he's obviously found it a lot harder than he expected. The trust really struggled to deliver its efficiency savings this year, which it needed to hit to meet its 50 million deficit control total. And it was off track by about 9 million at the end of October. It kind of pales in comparison to what was happening at the trust before, but clearly he kind of thought it was the right thing to do after that record. It's worth pointing out, because it's often the case with these sorts of board level departures. The trust insists there was no pressure kind of from regulators or the board for him to go, and it was his decision. It'd be really interesting to hear from him about his experience in the NHS, and I've kind of asked the trust for an interview, and still waiting for a reply on that.
And it's obviously kicked off. This has kicked off a pretty active debate on the HSJ website and the reader comments and on Twitter too. Give us a flavour of some of that discussion of both the manner of the way that Nick announced his departure and the private sector background. What are people saying?
Yeah, I think a lot of people are kind of giving him credit really for kind of fronting up and taking responsibility, and others are questioning where the board and the trust clinical leaders were in this. It's not just down to the finance director to improve the deficit. It's down to the whole board and the clinical directorates. There was another commenter who and there might be truth in this, who pointed out that plenty of NHS finance directors would probably be keen to leave the service at the moment, but they perhaps don't have the same range of options as someone like Nick Swift, who obviously has that long background in the private sector.
Yeah, I was going to say, how does this make this situation slightly different, that he has come from the private sector? And have you noticed a trend at all?
Yeah, I suppose it's different, but just because you don't, I haven't often seen people coming in from that type of role to take NHS FD jobs. Finance directors tend to kind of work their way up from within trusts. And I was trying to think of other people that had come in from the private sector and had done well or badly, and it's hard to think of that many actually. The only one that came to mind initially was Siobhan McArdle, who was chief exec at South Tees, who spent a long time as a management consultant, including at PwC, I think. She was there for 4 years and kind of ticked along, but left quite dramatically earlier in the year, talking about the regulatory challenge and saying life was just too short, and the efficiency requirements were too difficult to meet. So that's an interesting link between her and Nick Swift.
It is. I mean, it's possibly a slightly different cup of tea to compare chief execs to people in the finance director or director of strategy and things like that, where we may not know all the cases where people decide at some point in their career to come into the NHS, but bringing in NHS chief execs from the private sector is often a kind of sort of slight sort of celebrity issue that politicians like to happen upon every few years. I think the last instance was under Jeremy Hunt, where the government would like to kind of find a way to bring in private sector
But you
talent.
see it quite often, don't you? Sorry, Rebecca, but you see often when someone's appointed from the private sector, it's made a point that they're coming to join the NHS from outside. And I've been at numerous conferences, and I'm sure you have as well, where what can the NHS learn from the private sector, attract people from the private sector to the NHS. But this is obviously an example where it hasn't worked. And maybe that's about the NHS, or maybe this is about the trust.
It seems to be a bit of a myth to me that the NHS has created, that you get these saviours that come in from the private sector. But off the top of my head, I can't really think of a substantial saviour that has come in. Not to say that they've done a worse job, but I don't think it necessarily gives them a golden CV.
Tim Smart did quite a few years at King's College Hospital Foundation Trust. He'd come in from BT Global Health, which was possibly, and coming in to a very big trust like that. He was one of the big cases over the last sort of decade, and he easily was there for a decent duration. With some success, but also clearly not a sort of silver bullet solution, because King's has now found itself in a lot of severe difficulty. And the other cases that we could think of, Paul Mears had come into a much much smaller trust in Yeovil a few years ago, and again and he left and is no longer in NHS chief executive position. So we certainly between us chatting before couldn't think of cases of people who are still in who've come in from the private sector and are still successfully in very senior NHS management positions. There are, I think, possibly management consultancies an exception, where there's one or two out there. I can't remember if it's Oxford or UCLH possibly. I think one of those guys came from management consultants.
Lawrence, I just wanted to ask about the future of this trust. It's obviously, as you said, it's been a long running story here. What do you think is going to happen now?
Well, we know they've got a merger planned with the mental health trust on its patch, which is again quite unusual. That they already share a chairman, and I think that's due to happen in the next couple of years. So whether that will be a good thing, I don't know. On the finances, it is hard to see a way back. Really, they've still got a deficit of 50 million. And yes, that they'll have kind of financial recovery funding to help them over the next 4 or 5 years, but they'll also have a huge book of liabilities in the form of the bailout loans that they've had to draw down from the Department of Health. So I can't really see under the current system and structure how they're ever going to get back into surplus.
Is this a job that anyone can do? I mean, he was only in post for 14 months, so will the next person that comes along necessarily be able to fix it?
Yes, it's very difficult to see how anyone can just come along and fix it, and indeed he was highly spoken of actually from people in the trust, and he may well have done a decent job, and as good a job as anyone would have done. It's hard to say really.
I've seen some NHS people speaking from the other point of view, is wouldn't the accountable thing to have been done to stick around and continue trying to fix it if he's actually making inroads, but it's perhaps unfair to judge someone's career choices in that way. But.
Quite, yeah. I mean, yeah. It's without kind of speaking to him and interrogating him a bit more. Right. It's difficult to know, isn't it? But ultimately, he might have just not been enjoying it that much and had a tempting offer from somewhere else. Right,
Nick, come on the podcast next week. We'd love to talk to you. And we've come to the end of our time this week. We talk on Thursday afternoon, shortly after the publication of the Labour Party manifesto, and we're expecting the Conservative Party manifesto to be published over the weekend, perhaps, or early next week. So we're going to plan to bring you an HSJ Health Check manifesto special some point early next week. So please join us for that. That will be available across all the normal channels and on the HSJ website. please do spread the word of our HSJ Health Check podcast on social media and in real life and anywhere else you could choose to share it. If there are any issues you'd like us to tackle or discuss, send us any feedback, good or bad, via email dave.west@wilmingtonhealthcare.com or Twitter at davewwest or at HSJ News. And see you early next week for the Manifesto special. Thank you, everybody.
Thank you.